So,
Daily dose of history.
There you go.
yeah, I've learned how difficult it is to even manage our little setup here with hiccups at 1 minute till 9. And so, yeah, it's 8:58. We'll wait. She'll get it all logged in at 9 o'clock and just get you started. You just go.
Sure. We had to move our executive board similarly to online, and of course they're from all parts of the state, and a couple members are in like Southwest Indiana, which is very broadband challenged.
Right.
And so it included the chair of the board, which made things a little more difficult. She's trying to run the meeting remotely, and time
It's tough.
and all that.
If somebody locks up, and then we've had a problem with a council meeting like that.
Yeah.
Did you have a comment before we started?
I was going to say, the mayor has offered this up every 2 weeks for the last year
Oh, good.
for a COVID. Tell you where we're at.
Yeah.
Take questions. Meeting of minds just ahead of this meeting. It's been the best fit for our community, I think. I mean, it's really helped manage my day in getting word out.
Well, just
And it's
bringing
at
all
the structure
questions
every
together.
2 weeks.
Well, he's always the primary guest, so we turn it over to him, and he likes that role.
Yeah.
You just
yeah,
get to be the MC.
sidekick. I prefer
I'd say a little bit more than that.
But it's kind of funny though, because most of I think of the time in public health, people don't expect that this is what you'll end up
No.
doing, and then all of a sudden you're thrust.
I know. I go there kicking and screaming, quite honestly, but he drug me out. Good for him.
Well, both Kurt and they do a great job. Actually, we're thinking about syndicating. And these guys keep us honest, so it all works well. All right, I think we're ready.
Okay, great. Good morning, everyone. My name is Shane Hatchett, and I'm the Chief of Staff at the Indiana Department of Health. It really is so great to be here with you today in Warsaw to kick off the mobile clinic that we're hosting in Kosciuszko County. And I really want to thank the city and county leaders who have come together with our state teams to make this possible, especially Mayor Talmer, Dr. Remington, and Mr. Carlson from the Bowen Center. This clinic is one of 2 mobile units that we're offering this week in conjunction with our FEMA mass vaccination site in Gary, Indiana. Our goal with these clinics, along with others that the Department of Health is offering around the state, is to bring vaccine to people who really need it and communities where it's really needed. And sometimes that can be where access is limited or where demand has really outpaced supply in the local communities. So we're really monitoring that closely and trying to respond as quickly as possible. More than 14,000 residents of Kosciuszko County are fully vaccinated, and almost 20,000 residents here have received their first dose already. That's encouraging to see, but it's important to note that there are 60,000 residents in this county who are age 16 and older, and therefore currently eligible to receive the COVID-19 vaccine. So that means that we are only about a quarter of the way in terms of getting these residents in Kosciuszko County vaccinated. In addition, we continue to see lower rates of vaccination statewide among our Black and Hispanic residents, which increases the risk to those Hoosiers for illness from COVID-19. We really want to eliminate those disparities and remove any barrier to this life-saving vaccine, and that's where I think today this really comes together, and we're asking for your help to get the word out about this clinic and make sure that folks are aware of its availability and really the importance of this vaccine and how it has the ability to get us out of this pandemic and back to the normalcy that we're all so eager to get back to. The shot being offered is the Pfizer vaccine, which is a 2-dose series. It's safe and effective at preventing severe illness and death from COVID-19. This has been demonstrated through rigorous and unprecedented clinical trials across the country. Millions of vaccines have been administered in all kinds of communities across the country, and the adverse reactions have really been minimal by comparison. The COVID-19 vaccine is one of the most effective tools we have to prevent COVID-19, and when you combine that with wearing a mask, staying home if you're ill, keeping your distance when you can, and washing your hands, it's a proven strategy to prevent infections and the spread of this disease. These steps are more important than ever right now because we're seeing an increase in the variants of the virus, and these variants, as we're finding, are much more infectious than the original version that we've been dealing with for the past 18 months. So if we are to get out of this slump, so to speak, we really do have to get ahead of the curve. Our biggest increases statewide in COVID-19 infections are occurring among people in their 20s and 30s. And incidentally, these are also the folks who are struggling the most to get vaccinated. We are seeing higher hospitalizations across the state, and even here in this part of the state, we've seen a more than 100% increase in hospitalizations recently. So again, it's stressing the importance of the vaccine and how it can at least reduce the severity of an infection, if not altogether prevent it. Right now in Kosciuszko County, there's a positivity rate of just under 5%, and we want to keep it that way, but it's becoming more challenging as we see the number of variants of the virus increase, and people are letting their guard down. The science behind mask wearing has not changed. It's an effective tool to prevent illness, and we've seen proof of that in our extremely low numbers of influenza cases over the past year. So we continue to encourage people to wear masks when they're around people and cannot socially distance, and of course practice all of these other non-pharmaceutical interventions we've been talking about over the past year. But back to the vaccine, more than 3.7 million doses have been administered here in Indiana to 1.6 million Hoosiers who are now fully vaccinated. That's just over 25% fully vaccinated. We encourage you to join that group. We want everyone to come out and get the vaccine if they're eligible, which would mean 16 and over. If this site doesn't work for your schedule or the timing isn't right, we have 700 other sites at any given point around the state, and you can find them at ourshot.in.gov. The vaccination is free. We only ask for your name, date of birth, and personal information so that we can make sure you get your second dose and connect with you with any important follow-up information necessary. The only way we can put this pandemic behind us is to ensure that we are vaccinating the majority of our population and achieving herd immunity. I know many people are still hesitant about the vaccine, and certainly the pause that was recently placed on Johnson & Johnson by the FDA and CDC haven't helped that conversation. But I want to point out that a pause is just that. It's temporary in nature, and it's really demonstrates that the safety rails and the guardrails put in place to protect Americans is working. The brief time that this vaccine has been placed on pause is really to allow the CDC and health officials at the federal level evaluate these 6 rare cases of adverse events. And so what we can do from that is learn how to better identify potential risks and how to treat them if need be. It's important to remember that these cases represent less than 1 in a million people who were vaccinated. Those are very low odds. If you know of someone who has been on the fence about getting a vaccine, I encourage you to speak with them and get them an appointment available. And as Mayor Tallmer reminded me, we of course have walk-ups available, and the hours of the clinic are really designed for all walks of life from 9 a.m. to 6 p.m. so we can really meet people where they are and get them this life-saving treatment. Mayor, thank you.
All right, thanks, Shane. I certainly appreciate your time this morning. I know you're busy down at the pavilion getting things set up, and sounds like we got a pretty busy schedule today. But as mentioned, the advantage here and what really is going to help us is creating more accessibility to the shot for people that are need to work, and being able to schedule an appointment as late as 6 p.m. as well as all day Saturday is really the advantage that we have with you all here. And again, we're most appreciative. The other, as we've mentioned, there are walk-ups available now, so there are some slots available, and if you're on the fence, just jump in the car and we can take care of your registration at the site. But most importantly, we've worked, the city along with the county and the Bowen Center and our Northern Indiana Hispanic Health Coalition have worked hard to get the word out. We sent a group out canvassing neighborhoods and handing out brochures last week. We spent our press conferences talking about the importance of the vaccine. The message is the same. We've got to get shots in arms, and you've given us now a great opportunity to expand that here in this community. I know you mentioned we're doing Pfizer, which means 2 shots. We've been Pfizer all along, so nary a concern with the J&J at this point. It's worked well for us, and we will be back, or the state will be back, we hope, on May 11th through the 15th to give the second shot. I assume those appointments will be made today or this week as folks are getting their shots. So with that, I'm going to turn it over to Dr. Remington to give his perspective from the health department, and then we'll ask Kurt to weigh in from the Bowen Center.
Thanks, Mayor. Thanks, Sean. Really greatly appreciate the Department of Health at the state and our federal partners that bring this wonderful opportunity to our community. It is a great opportunity. I think the timing is perfect. The emerging variants causing great havoc not too far away in Michigan are noteworthy. Our cases ticking up a little bit. April is the month to get this done. We have very safe and amazingly effective vaccines. I implore Kosciuszko County to just get her done. This is your time. Thanks.
All right. Thank you, Dr. Remington. And Kurt, I know Bowen Center has been working very hard getting folks registered, those that are technologically challenged and those that potentially have a language barrier. Your staff has done a great service to our community, pivoting from the testing, which you're still doing, by the way, but also manning the phones on the hotline and helping fill these slots. So I'm sure you've got a little bit more to say about that.
Sure. Well, let me even back up further than that. Appreciate the governor's guidance and the health department, the press conferences that he's had. So when the emergency order was given, Bowen Center, which is the largest mental health center in the state, we have about 1,500 employees and growing. We followed those phases, and it was good guidance. We have an infection control nurse, Laura Borsa. In fact, we were just on the radio here a couple weeks ago, and she was sort of answering questions from the public. She's given us good guidance. So I think we, as a healthcare organization, have tried to model the right behavior in terms of being safe, sent people home. We didn't lose many people except those who couldn't do childcare and their work at the same. Then, according to the phases, we brought people back. We brought them back safely. We've kept our environment clean. And then once the vaccines were available, we've really promoted it, again, following the age stages that the Department of Health has set out. So again, I think we have shown that we believe in the science, the technology, and now the vaccine. So when the health department reached out to us and said, the testing site is more than we can manage, would Bowen Center be willing to? Dr. Remington and I and a couple of my staff met, and it's a privilege to serve. And so we put a plan together, submitted that to Dr. Remington and his staff. They vetted it with the state and the Department of Health, and they said, looks like it'll work. And so it was a 6-day-a-week because some of the population, they work during the week and haven't the availability, and we varied the hours, so we'd have some evening hours, some earlier hours. And we started out, the first day was 130 some people, and it sprang up our highs of 300 people a day we were testing. I'd contend that there probably is another test site in the state that did that. And as you mentioned, the Hispanic population is, in Kosciuszko County, is about 7%. All of my staff that I hired were bilingual, bicultural. That was intentional because we wanted to make sure that the Hispanic population felt comfortable coming. And everybody's uncomfortable with this disease and the testing and all that. and we wanted to make it as barrier-free as possible. And many of the people who came to the test site and continue, so we're averaging about 15 to 20% of the people coming to the test site are Spanish-speaking, Hispanic. And when the population's 7%, we're really reaching that population as aggressively as we can. And so then as testing started to wind down, the vaccine was available, how are we going to get the message out to the persons who don't speak English? Because the website for the state is only in English. And so we put together very rapidly in 48 hours, worked out the technology to have a hotline for A, people who only speak Spanish, and B, people who are technologically challenged. Either they don't have a computer or they have difficulty with the computer. And so right now, as of the last count, 45% of the people phoning that hotline are Spanish speaking. So again, we're really trying to reach that 7% of the population who, as you said earlier, are the most vulnerable. We have a very small black population in this county, but they're accessing also. And so we're manning that hotline throughout the week. And started out, most of the calls were asking questions. And a few people wanted to get registered. Now almost all the calls are to get registered. So as the communities become more comfortable with the vaccine, now they're calling to say, I just need help getting it. We've also, Bowen Center opened up our first federally qualified health clinic here this past year. We just, a couple weeks ago, got our HRSA designation as a look-alike. We're now in the process of going through the steps to access the vaccine to become a vaccination clinic. And as I'm sure you're aware, the federal government has a lot of requirements that you have to meet. And so we're going through that process, and it's slow, it's arduous, but we will get there. So again, it's a privilege for us to serve the community in this way during a pandemic. Well, history will judge what we do, when, and why. And I want to be on the right side of history.
Just handed out the brochures that our fire chief brought in. This is what was handed out last week, and you'll see their bilingual FAQs and then the specific promotion of the clinic. So our fire chief ducked out, but I certainly want to thank him and his guys that went out, and that whole group of our local Northern Indiana Health Hispanic Coalition call we do every week or two as we're working through this. It's really nice to have someone from the Indiana State Department of Health sitting up here with us. We felt your presence since last March throughout this whole thing. As Kurt mentioned, I think we've certainly been used the guidance by the governor's office and the State Department of Health as our flagship, if you will. And I know Dr. Remington and the Department of Health, we all rely on that direction and have been gratified that we've got the leadership that we've got. And this is just another example of that. But I did want to mention that. I wanted to publicly thank the State Department of Health for everything you all have done. So I think with that, if there are questions, Dan Spalding from Inc. Free News. Dan, if you want to use the microphone, because we are streaming this morning as well. Thank you.
Good morning. My first question is for the mayor. Obviously, the local community worked hard to get a big clinic like this. Is this our biggest and best chance? I mean, there's not going to be another one, is there?
Well, I think the accessibility by age now, we're down to as low as we can go, so it's pretty much open for everyone. As Dr. Remington mentioned, we've got momentum, we've got inertia, we've got people coming back from spring break. There's still awareness, there's a little bump in the numbers, and that tells people that it's not over yet. And those things are all, I hope, weighing on people that, we're just not gonna, this isn't just going to go away. We all have to do our part and take our shot. And I would say this is probably the best opportunity we've got and had so far. And I don't want to forget the great work the health department has done out at the K-21 pavilion. Those vaccinations continue on a regular basis, and that's kind of our foundation and our baseline. And this today is a big vaccine party, if you will, to get everybody to show up. So.
Mr. Hackett, since the state started allowing walk-ups, are you seeing any increased trends there? Is that helping much?
It really has been. In other of these mobile clinics that we've done, we've found that oftentimes there's a hesitancy within these communities, and if you remove all the barriers and someone is literally driving by and they see the sign and they think, well, I'll go check it out, that's just one more opportunity for us to bring people along the way. And so the walk-ups really have been helpful. It certainly is great from an administration perspective to have people fully registered when they show up, but we are staffed appropriately to take as many walk-ups as possible, and we'll get people through. If you show up and there's a shot available, we will put it in your arm.
Also, I think you referenced it that there's more younger people becoming ill.
Yes.
And were you suggesting that people in their 20s and 30s are more hesitant than expected?
I don't think it's hesitant as much as the typical health trend that you see with that age group, which is, the invincible person mentality. And at the same time, I think in addition to that, it's because the disease is oftentimes not as severe for that age group, there's less, I think, concern. But what folks aren't realizing is that you put the people around you at risk, your loved ones, and particularly your grandparents and your parents, and those with comorbidities who are at higher risk for more severe disease. So that's really why we're focusing as heavily as we are on those 20 and 30-year-olds to help them understand the importance of this, that it's much bigger than you. Don't be selfish about it.
This is David Sloan from the Times-Union.
Kind of a related question. A lot of people I've talked to who don't want to get it right now, or they say they want to wait maybe a year to see if there's side effects or something. They want to see what happens to everyone else. In a year's time, what could it look like for that person who didn't get it, and what could herd immunity be in? So maybe in a year's time, what will it all look like?
Well, I think a year's too late, honestly. Each point at which you are not getting vaccinated is a potential to become infected and to infect those around you. And so again, it's about thinking of the bigger picture here and looking at the science and the data behind this. As a country, we have administered millions upon millions of doses of vaccine with very few adverse reactions. And honestly, I've worked multiple of these sites, and we always have EMS on standby just in case. And 9 times out of 10, it's needle anxiety. That's what the adverse reaction is on site. And so, it really, I don't want to downplay or diminish the folks who do have a true, genuine adverse reaction, but they are so few and far between. And I think that's a testament to the rigorous level of testing and clinical trials that these vaccines have gone through. And reiterating to folks that, yes, the vaccines did get to market quickly, but that's because we sped up the regulatory paperwork behind it and the production delays, not that we skimped on any of the important underlying scientific testing. And Dr. Remington, I don't know if you want to, from a medical or clinical perspective, weigh in on some of that, but I think everyone up here on this dais has been vaccinated, and I have no adverse reactions or side effects that I could report on other than some sore joints the next day.
Well, I can add a scientific piece. This is a gnarly and wily pathogen. Don't play with fire here. Just get immunized.
And the other question I often get is, if I get vaccinated, why do I still have to wear the mask? Can you explain that a little more?
Yeah, so I think throughout this pandemic, we've approached this from a cautious perspective, and we're still learning a lot about the disease, and we're also still learning about the vaccine in some ways. And what we don't know, what we don't have enough data on at this point is, can you be an asymptomatic carrier for the virus while being vaccinated? So what that means is you would not have any symptoms or otherwise be knowledgeable that you are carrying the coronavirus, and potentially go and visit a family member in the hospital or a long-term care facility and then pass that along. That's the concern that we're looking for there. And what we know is that wearing a mask does cut down on transmission rates. And the mask has always been about people around you, not as much yourself. And that's what this boils down to, is we don't want you carrying this virus into a setting where it can get foothold and really have disproportionate effects and frankly, very bad effects on people who are at higher risk for the disease. So that's why we continue to recommend wearing the mask. And frankly, because until we reach herd immunity, there's no telling who's vaccinated at this point, or if the disease could continue to spread rampantly, which is what we're seeing in other parts of the country like Michigan.
All right, anyone else? Any questions? All right, again, just to close out and remind everyone, clinic's open. Opened about 25 minutes ago. We'll go till 6 tonight, and for the rest of the week, including Saturday, jump on ourshot.com or our hotline at 347-4256 to schedule an appointment. And if you're driving by and you see what's going on and decide you want to poke your head in, go ahead, because we can register you on site and would be happy to do so. Final thoughts, anyone?
I'll just say, I appreciate the praise that you gave us at the state level, but I think that I would be remiss if I didn't sit here and thank you folks for the work that you're doing at the ground level. Public health, where you really the rubber meets the road is at the local level, and so we're just so appreciative of what you folks have been doing. And when we look at communities that have really kind of gotten things under control and are operating smoothly, it's when elected officials, public health, and others are doing exactly what you are. So I'd love to see this replicated across the state. Thank you so much.
All right, thanks, Shane. Have a busy week. All right, I think that's it. Mike, thank you.